Next question is to Kathy. What is the difference between punishment and discipline, and do timeouts work?
So the first thing I'm going to talk about a little bit is when we're talking punishment, a lot of times we want our children to be punished when they misbehave. But when you're punishing, that's really putting the child in a situation where they're ashamed or they're embarrassed of the act they did, but they don't know how to correct it. They haven't learned the skills or what the appropriate behavior is. So it's mostly so punishment is based on making the child feel ashamed and embarrassed about the behavior that they've done so they can correct it in the future. But it's not positive because they won't be able to apply that skill in multiple situations. Whereas if you're talking discipline, when we talk discipline, the process helps the child learn a new skill. So for example, a clear way we could explain this is with timeouts. So if you put a child on timeout, therefore removing the child from the situation so they can take notice of the emotions they're feeling and be able to calm themselves down, they're learning to self-regulate. Again, self-regulate being that big word that just means they're learning to identify the emotion, calm themselves down, and bring themselves back to where they can interact with other people. So you're removing those stimulus around them, and eventually they'll be able to self-soothe or self-cope, and they'll be able to do this in public and won't need to always be in a timeout. So when you're talking discipline, you're talking really giving them coping skills and skills that will be with them throughout their life. So very effective and doesn't cause any resentment, so it's a very positive thing for the parent-child relationship as well, or the caregiver-child relationship. When we want to talk about timeouts, and timeouts is a very hot topic because we see it on many shows and we see it done in many different ways, and a lot of times we get a lot of mixed messages. When timeout is used appropriately, it's very effective because the child is learning what isn't acceptable and what is the expectation of that child. And when I say it should be done properly, what properly is timeouts should have no longer length than 5 minutes. And while that child is in timeout, that child should have no interaction with anyone, and the child should have a very clear understanding of why he or she is in timeout. So for example, if I were to put a child on timeout for having done a tantrum, I would bring the child, if the child can't bring themselves, I would gently bring them over or guide them to a secure area, which may not necessarily be a bedroom, because a bedroom is full of entertainment and distractions, but a safe, secure area that allows for soothing. And I would let them know, you have not done as I have asked, and this is not acceptable behavior. You are now going in timeout for 3 minutes. After which 3 minutes, you have to be certain that you want to respect that time as well. If you told them that you would put them on timeout for 3 minutes and you leave them there for 10, you're going to have issues using that strategy. So it's being true and realistic to what you can do as well. So if you're putting them on timeout, make sure that you respect that 3-minute time limit.
Thank you, Kathy.
So if the child doesn't want to go, can you clarify for me a little bit as what would the child say to you? And by the way you're talking, I'm getting that this is a small child.
No, she's 8 years old.
8 years old. So sometimes for parents it's very difficult, but the trick is first communicate with her. So a lot of times when they're in a tantrum, it's very difficult. They won't hear your words. They're in their own space, and they're not able to verbalize. So you want to bring her to a point where she's able to verbalize and doesn't have to use that tantrum. So prevention is key if you can prevent her from getting to that tantrum. And by prevention, the way you would do that is really getting her those verbal skills. So identifying, what are you feeling? So if you're upset, you don't have to do a tantrum. We can talk about it. So mother or father or mom, dad, I'm feeling really angry, and what can I do about this? And this is something that's very difficult for children to do because a lot of times they can only identify with major emotions. They know what sadness is, they know what anger is, but if they're anxious, they can't describe anxiety. If they're confused, those are complicated emotions that they have a lot of difficulty expressing. So it's giving her those skills. Again, you can't prevent all tantrums. So sometimes you do have to use the timeout. And like you said, if your child is tantruming on the floor and you can't get her to verbalize, then it's gently guiding them. So giving them the option, can you go to your room, or do I have to guide you to your room? And if you have to guide them, then it's gentle guiding. Holding the hand, or, I mean, at 8 years old, she's probably too big to carry, but it's using that gentle guiding as much as you can.
And it may be over and over again, right? So she may be getting out of timeout and you're bringing her back and bringing her back. I mean, I've heard, you hear from a lot of parents, I brought them to timeout 50 times, and that's the thing, but it's being consistent and keep doing that. And you'll see, that it becomes less, and you're not, the first time maybe 50 times, the second time maybe 40 times, but it will gradually get less because she knows that you're going to be consistent and that this is the consequence for that behavior. So it will get easier.
Thank you for the question.
Mm-hmm. So when they have a harder time understanding what? Sorry, if you could clarify. So the first thing I want to clarify is timeout only starts around 18 months of age. So once a child hits around that age, they're developmentally able to understand what the timeout is. One of the best things you could do is practice, show them. So the example I like to use is maybe a teddy bear. Okay, and that sometimes with autism, you're looking at special strategies that work better with that parent, and there is, or with that child, and there is a specific program that adds information to children with autism. I believe, Connie, can you speak to that program?
One of the programs that are geared specifically for autistic children, as well as ASD children, is what is called the Stepping Stones P.2 program. Okay, the Stepping Stones program is there's two different formats. One either done in a group setting with other parents who have similar challenges with children when we look at special needs, and then there's also the one-on-one program, which is offered through Child Care Resources for children with autism. Okay, amazing programs. The P Stepping Stones program offered through Child and Family Center, yes, that is done through CCN. The intake is completed and then assigned through Child and Family Center. CCR also has an intake process with CCN as well. So I'm not sure, Kathy, is that?
And you can also self-refer to the Stepping Stones program. The group program, I should say. So if you do access the P website on our local website, which would be https://p.mysudbury.ca. I believe it's all going to be available at the end as well, if I'm correct. If not, I'd be happy to speak with you at the end as well. But you can self-register, so the groups are, if you go under group 0 to 10, so there's a section for the 0 to 10, you're going to see any groups that happen in our region that are stepping stones. And we offer 2 stepping stones group sessions per year, so usually fall and spring.